Hello, I'm Dr. Rudy Scarfalloto. I am a chiropractor. I've been practicing for about 25 years in the Atlanta area, and I'm also a massage therapist by training. And I am an instructor of anatomy and physiology at ASHA School of Massage, and this is the first in a series of videos on the anatomy and physiology course that we teach at ASHA, which obviously is geared towards massage therapists and prospective massage therapists. Now, the first thing I'd like to talk about is the style of teaching that we use at ASHA. In our anatomy and physiology course, we use all three portals of learning. And what does that mean? It means we use the audio, the visual, and the kinesthetic portals of learning. Audio simply means you learn by listening, by hearing. Visual means you learn by seeing, and kinesthetic means you learn by doing, by touching. And I find that the audio portal of learning in and of itself is not very effective. Audio means the teacher talks and you listen. Visual is also very important in teaching anatomy. So we have lots of charts, bone charts, muscle charts, and lots of models and other visual aids. Now, the kinesthetic portal is especially important for massage therapists. So in our anatomy and physiology course, we do lots and lots of hands-on work. Now, the main emphasis in any anatomy course taught in massage school is going to be, as you might guess, the muscular system. Here is the muscular system. It consists of about 700 muscles, and most of them are paired. And the job of the muscles is to provide us with all of our externally visible movements. They do that by contracting. Muscles shorten. Like, for example, this muscle called the biceps brachii. When it contracts, it pulls on the forearm and allows us to bend the elbow. Now, most of these muscles are attached to our bones. So we also study the skeleton. Our skeleton consists of 206 bones. The whole thing weighs about 30 pounds. And the skeleton actually is two skeletons, which we call the axial skeleton and the appendicular skeleton. The axial skeleton consists of the skull, the spinal column, and the rib cage. And the appendicular skeleton is our arms and legs. Now, you will notice that the bones of the axial skeleton are fairly small, and they are fitted pretty tightly together, so they don't move very much. Consider the skull here. The skull looks like a single bone, but actually it's 29 bones, most of which are fitted very tightly together. Now, in contrast, the appendicular skeleton consists of larger bones. Long bones, like the long bone here. This is the humerus, the arm bone. And this is the femur, the thigh bone, which is the largest and strongest bone in the body. These bones form very freely movable joints, which gives us all the free movements that we are associated with in walking and climbing and swimming and throwing a ball, things like that. Now, in learning the skeleton, we don't just learn names of bones. Yes, you will learn the names of all the bones. But we also have to learn the names of the bumps on the bones. For example, on the back of the elbow here, if you feel your elbow, that bump is called the olecranon process, which is a bony projection on one of the bones of the forearm. The olecranon process is where this muscle attaches. This is the triceps muscle on the back of your arm. It attaches to the olecranon process, and when the triceps muscle contracts, it pulls on the olecranon process and allows us to do this. And in that same manner, all of these muscles are going to be attaching somewhere on the skeleton, and they generally attach to the bony bumps that you can feel all over the body. So, why do we need this level of specificity? Why do we need all these details when we study the body? Well, quite simply because the type of massage that we teach at ASHA requires this level of specificity. When your knowledge is specific, your work can be specific. and this allows us to be more effective in pain relief and rehabilitation. For example, in my practice, I have found that one of the best treatments for a whiplash injury, which is an injury of the neck, is the right kind of massage, which means specific kind of massage, combined with the right chiropractic adjustment. Not only does that provide pain relief, but it also allows the injury to heal completely, rather than leaving a legacy of lingering pain and stiffness. And likewise, even in an old injury, a chronic injury, such as a shoulder that doesn't move very much and which has pain on movement, the right kind of massage, specific form of massage, can greatly increase mobility as well as reducing the chronic pain. So this is the kind of massage that we teach at ASHA, and it's also the kind of massage that we practice in our clinic. And this concludes our first anatomy and physiology video. I invite you to view the other videos at ashamassage.com in the resource section. And while you're on the site, you can check out our clinic, and if you'd like, you can book an appointment. So thank you for watching, and hope to see you in class.